Hello, everyone. I'm Dr. Shubham Pant. I'm an associate professor in the Department of GI Medical Oncology and in the Department of Investigational Cancer Therapeutics uh, at MD Anderson Cancer Center in Houston, Texas. Today, I'm going to talk about targeting HER2 new in biliary tract cancers. These are some of my disclosures, my honorariums, and research paid to my institution. Now, as we know, and as you probably have seen in multiple presentations, that biliary tract cancer or cholangiocarcinoma is not one disease. It's actually many different diseases in a way that you can have intrahepatic cholangiocarcinoma behaves differently than extrahepatic cholangiocarcinoma and hilar cholangiocarcinoma and behaves differently in a way than gallbladder cancer. Again, it varies where these cancers are found, which parts of the globe, and what, importantly for this talk, what mutational profiles do these cancers hold? Now, the molecular genetics of BTC is well characterized in this slide. As you can see that we were talking about the ICC, intrahepatic cholangiocarcinomas, extrahepatic cholangiocarcinomas, and gallbladder cancer. And this slide, this talk is specific towards HER2 new targeting in cholangiocarcinomas. In this, you can see the percentage is the highest in gallbladder cancer. So the HER2 or the HER2 new amplification can be about 9.8 to 19% in gallbladder cancers, and this is across different studies, small and large. In extrahepatic cholangiocarcinomas, it can be 11 to 17%. And in intrahepatic cholangiocarcinomas, we really do not see a high prevalence of HER2 new amplification. We really see more things like FGFR fusions and IDH1 mutations. So that's what we see predominantly in patients with biliary tract cancers, which are intrahepatic. So what we are really looking for in HER2 new targeted is gallbladder cancer and again extrahepatic cholangiocarcinomas. Now I'm going to talk a little bit, which you may have, you're probably familiar with this study, which is the second line study, and I'm going to give the context of it as far as targeting HER2 new in this disease is concerned. So this is the ABC06 trial, which is a randomized phase 3 trial. Again, randomized patients into FOLFOX, modified FOLFOX, or active symptom control or active symptom control as one of the biggest second line randomized trials which is out there. So again, patients were randomized in a 1:1 fashion by active symptom control or active symptom control plus modified FOLFOX, and they were stratified according to platinum sensitivity, serum albumin, and stage, which was locally advanced versus metastatic. The primary endpoint, as you can see, was met. The hazard ratio was 0.69 for overall survival in the patients who received FOLFOX versus the ones who were just on palliative care. But again, the survival advantage was modest. So it was about 5.3 months with patients who were on the supportive care versus 6.2 months, which was the patients received FOLFOX. And again, this is the response rates. As you can see, the response rates was about 5% in the patients who received FOLFOX, so relatively modest. So I'm going to show you a few, mostly HER2 new targeting in biliary tract cancers. Again, small numbers, but relevant numbers. And there have been some smaller reports which have been which have been published and have been presented targeting HER2 new in biliary tract cancer, similar to what was with the agents that were used in breast cancer. So as you can look here, this is by one of my colleagues, Dr. Javle. In this, this was published with gallbladder cancer. Again, patients with prior therapy. These were 9 patients. And as you can see, there were 3 patients out here who received, 4 patients who had a partial response to therapy. And these patients were treated with trastuzumab. Some of them it was given concurrently, and some of them it was given as single agent. Again, they were either next-gen sequencing amplification or they were FISH amplified with trastuzumab. So this was the first kind of proof of principle that this really targeting can work in these patients with HER2 new positive cholangiocarcinomas. This was one of the patients who was treated, which was published, and as you can see, they did get a really good response while getting the targeted therapy. This was another one paper which was published by Dr. Dombrava, one of my other colleagues, who's also speaker at the symposium in Journal of Precision Oncology. This was targeting HER2 amplification identified by next-gen sequencing in patients with advanced metastatic or solid tumors beyond conventional indications. And one of the biggest conventional indication, as we know, is with patients with breast cancer. And as you can see, the number one patients were colorectal cancer. In the number one, the patients, about 30 patients had colorectal cancer, but 21 patients did have biliary tract cancers. And, Kathy did a very interesting analysis, Dr. Dombrava did a very interesting analysis of looking at progression-free survival 2 versus 1. That means if a patient had had a previous line of therapy, what was their progression-free survival? And then, because this was a retrospective study, and then looking at the progression-free survival of the HER2 targeted therapy, as you can see, the hazard ratio was about 0.44, which was benefiting the patients who received HER2 targeted therapy. HER2 target therapy, so the progression-free survival was better than those who did not receive than their previous therapy, which was not HER2 targeted. So this is a good proof of principle that these agents are active in these diseases, especially biliary tract cancers. So now I'm going to present to you something which we presented in Cholangiocarcinoma Summit last year. This was preliminary results of zanidatamab, ZW25, and HER2 amplified biliary tract cancers. And I'm going to talk a little bit about where the science is going forward in this disease. And this was presented last year by me with my colleagues and collaborators who were part of this trial. So again, the ZW25 is essentially it's essentially binds to the trastuzumab and the pertuzumab binding domain, and it's a bispecific antibody. Again, the objectives in the phase 1 trial, and this was a phase 1 trial which was not limited to biliary tract cancers. It was a cohort. It was more of a basket trial. Again, the key eligibility criteria was advanced HER2 expressing cancer with progression after standard of care therapy. So all of these patients had some prior standard of care therapy. The biliary tract cancer patients that we're going to show you were treated with a recommended dose of 20 milligram per kilogram every Q2 weeks with the zanidatamab. And treatment-related adverse events, again, this monotherapy was well tolerated in the patients. Majority of the side effects were diarrhea and infusion-related reactions. The important thing was, as we know, trastuzumab, pertuzumab by itself can cause decrease in ejection fraction, which is in most part reversible. But for this study, we really did not have any zanidatamab-related greater than 10% changes in left ventricular ejection fraction. This is for the tumor reduction across many HER2 cancer types, not specifically for biliary tract cancers. As you can see, the patients had ampullary cancer, biliary, cervical, colorectal, different cancers. But this is the waterfall plot, which shows you that majority of the patients had response or had stable disease, which was going towards a response, and they had some negative reduction, or they said they had a net reduction in their sum of target lesions. These were the biliary tract cancers. As you can see, the majority of them did have a response or had a decrease in the reduction in the sum of targeted lesions, which was about 63% of the patients. And again, this response was sustained. The median progression-free survival was again about 5.2 months. These were heavily pretreated patients with a partial response, like we said, of 63%. Another 13% had stable disease. So the disease control rate in this biliary tract cancer population, which was part of this basket study, was about 75%. And that led to this phase 2 trial, which has already started. It's been activated at MD Anderson and at other sites. And this is a global multi-center open-label single-arm study to evaluate the anti-tumor activity of zanidatamab monotherapy in patients with HER2 amplified BTC. It's called the Horizon, HARIZON, Horizon BTC trial. And the key eligibility criteria are again, histologically or cytologically confirmed BTC, including gallbladder, intrahepatic cholangiocarcinoma or extrahepatic cholangiocarcinoma, locally advanced or metastatic BTC, not eligible for curative resection, transplantation, or ablative therapy. And these patients should have progressed on at least one line of prior therapy with a gemcitabine containing regimen. And we need new or archival tumor tissue required to confirm, and this is central confirmation of HER2 amplification. So really taking a thought, like taking a smaller trial, which is a basket trial, and taking this into a global setting in this disease is truly exciting. Again, this is the phase 2 trial design. About 100 patients will be in the single arm study. And some of the things that does not reflect well on the slide, patients are treated on 28-day cycles on day 1 and day 15. We have the primary endpoint is overall response rate, which is measured every 8 weeks. And the secondary endpoints are duration of response, progression-free survival, overall survival, safety, and quality of life. So excited about this global trial, which has recently launched and is already accruing across the globe. And with that, I want to end with this diagram, which I always like, which and the saying which says it always seems impossible until it's done. So biliary tract cancers, an orphan disease, HER2 positive or HER2 overamplified biliary tract cancer, again, a small subset of a positive disease, but we are seeing very strong signals of activity when it's appropriately targeted in some case reports and in a basket trial. There are other different agents which target HER2 are also being tried in biliary tract cancers, ADCs, other small molecules. So it's a very exciting field of development. So, we truly look at the iceberg in which what we have available for biliary tract cancers is here. And again, this whole iceberg is going to be lifted when we can really do a next-gen sequencing on every biliary tract cancer patient. And we can really make a little pie chart and sequence them into FGFR or IDH1 or HER2 and choose the appropriate targeted therapies for these patients. Thank you so much for logging into this virtual conference and for the talk. Thank you.